Let's start by talking about the role of the cariogenic bacteria. As many of you are aware, bacteria such as Streptococcus mutans and the Lactobacillus are responsible for the formation of the dental caries. If suppose this is a biofilm, and these are the bacteria which are present in the biofilm. Now, what happens is when they receive the sugars from the diet, so when the bacteria which is present in the biofilm is receiving the sugars from the diet, then they are metabolizing the sugars and they are producing some byproducts. These byproducts are acids. So because of the production of acids within the biofilm, the pH of the biofilm starts to drop down. So because of this acidic environment within the biofilm, the pH of the biofilm starts to drop. And the environment inside the biofilm becomes acidic. And this environment is setting the stage for the demineralization. Now let's move on to the concept of critical pH. Critical pH is a threshold below which demineralization happens and above which remineralization happens. For enamel, the critical pH is 5.5 and for the dentin, critical pH is 6.2. So for the dentin, the critical pH is bit higher. So when the pH in the biofilm is dropping down below these levels, so as already discussed, because of the fermentation of the sugars by the bacteria in the biofilm, the acids are produced within the biofilm, turning the biofilm environment into acidic. So if the acidic environment is dropping below the pH of 5.5, then the enamel starts losing its minerals and the process of demineralization is initiated. In the same way, if the acidic levels are dropping down below the pH of 6.2 in the dentin, then the dentin also starts losing its mineral structure and the demineralization really kicks in here. Let us understand the mechanism of demineralization. When the pH of the biofilm has turned acidic, the equilibrium is shifting. The tooth structure tries to balance the increased acidity by releasing the calcium and phosphate ions into the biofilm. So the tooth is trying to neutralize the acidity by releasing these minerals, but this results in the net loss of the minerals in the tooth, and this leads to a process of demineralization. Once the pH in the biofilm returns to neutral, remineralization can begin. During this process, calcium and phosphate that were lost from the tooth can be redeposited back into the enamel. This cycle of demineralization and remineralization occurs multiple times a day and is crucial for maintaining our teeth's integrity. In the next lecture, we will further explore about the dental caries. If you found this video helpful, hit the bell icon below and subscribe to my channel. Thank you for watching.